Assalamualaikum and hello everyone. We are from Group 5. We'll present on case study 2 which is about autoimmune disease, systemic lupus erythematosus, SLE.
Okay, this is the scenario for this case study. The first question is what is the significance of each of DW's laboratory findings? The first result is positive anti-nuclear antibody ANA titer, means that there is presence of autoantibody towards nuclear component in her circulation. The second result, which is positive double-stranded DNA, means there is presence of autoantibody towards double-stranded DNA. The third one, positive anti-smooth muscle antibody, means that there is autoantibodies towards the smooth muscle. The next result, which include elevated C-reactive protein CRP and also erythrocyte sedimentation rate ESR, indicate the presence of inflammation and its severity. The last result, which is decreased C3 and C4 serum complement, indicating that the disease is in its active stage.
Question 2. Given that most tests are not specific, how is SLE is diagnosed? Many of the symptoms are not specific to SLE and overlap with those of more common conditions. Usually, anti-nuclear antibody testing is useful as an initial screening approach, but it is not disease-specific test. When the SLE patients are tested positive in unattested result, additional serological, non-specific, and complement C3 and C4 testing are needed to confirm a diagnosis of SLE.
Number 3. What priority problems were addressed in DW's care plan at that time of diagnosis? First, her problem is to understand and digest the diagnosis, to monitor any development of pain, frequently check her vital signs, and perform other several diagnostic tests. Next, to understand the prescribed medication. And last, think the ways to live a normal and safe life with SLE.
Question 4. Which laboratory findings concern you and why? So the first is abnormal concentration of sodium and chloride. Second, elevated of creatinine and blood urea nitrogen. And the third is the presence of protein and red blood cell in urinalysis test. This result shows that DW's kidney are not working properly. Thus, based on the signs and symptoms too, she may be suffer on lupus nephritis where lupus autoantibodies affect structure in her kidney that are responsible to filter out the waste.
Question number 5. How will DW's treatment and care plan likely change? DW shows sign and symptom of lupus nephritis, which is also supported by the laboratory data. So the treatment also should focus on lupus nephritis. Lupus nephritis treatment usually focus on reducing the symptom and achieving remission. Conservative treatment like diet changes and BP medication should also be suggested or prescribed. Diet changes is like reducing intake of protein and salt in daily diet to improve kidney function. Blood pressure medication, on the other hand, helps control blood pressure and at the same time also prevent protein from leaking from the kidneys into the urine, which is a condition called proteinuria. Diuretics also can help in getting rid of excess fluid. Other than that, immune suppressant medication should also be prescribed to slow or to stop the immune system from attacking healthy cells. So, prednisone, which was previously discontinued, should be recontinued again. However, if the patient is not getting any better or have become worse, plasmapheresis treatment should be considered.
To calculate dose that will be received is by using body surface area. Since the cyclophosphamide is divided into two doses, dose per day will be divided into two. So, 84 mg of cyclophosphamide will be received for each dose. This calculation is to make sure medicine is effective and to avoid adverse effects.
The next question is about other findings that indicate CNS involvement from SLE that DW should be assessed for. Firstly is seizures that can happen due to inflammation and autoantibodies created by the lupus. Second is slurred speech, which is one of the major signs of stroke. Third, movement disorders, where there is abnormal increase or reduced movements, whether voluntary or involuntary. The next one is encephalopathy, where the function or structure of the brain is affected by the disease. And lastly, aseptic meningitis, where there is inflammation of the meninges, which is a membrane that covers the spinal cord and brain.
Question 8. What preventive measure that will be instituted to protect DW at this time? At this time, it is important to manage a flare-up of the symptoms so that the patient condition are in control. The preventive measures are avoid smoking and ultraviolet light. Exposure STs can worsen the lupus symptoms. Next, diet and nutrition. People with lupus should eat a well-balanced diet and change your diet if needed. Enough consume vitamin D and calcium are needed for strong bones. Exercise is important too, as being inactive will cause the muscle to weaken and can make them feeling worse. Medication, as shown in the slide, are also used to reduce lupus flares and other symptoms.
Question number 9. While caring for DW, which of these care activities can be safely delegated to the nursing assistive personnel or NAP? The first one is measuring her blood pressure every 2 hours. Second, assisting DW with personal hygiene. And third, emptying the urine collection device and measuring the outputs. But why only 3 of them are safely delegated to the nursing assistive personnel? Nursing assistive personnel is unlicensed nurse which are delegated to take nurse responsibility for the performance of a task monitored by licensed nurse. The tasks that can be done by unlicensed nurse, including measuring and recording vital signs, assisting the patient with their activities daily living, and also measuring and recording fluid intake and output. However, there are some tasks that cannot be legally and appropriately delegated to the unlicensed assistive nursing personnel, such as nursing assistant, nursing diagnosis, patient care technicians, and establish expected outcomes.
And what major complications associated with immunosuppression therapy will DW have to be monitored for? Metiprednisolone is a corticosteroid that have both anti-inflammatory and immunosuppressive effects. Monitoring is required because immunosuppressive drugs increase the risk of infections, malignancy, cardiovascular disease, and bone marrow suppressions. Bone marrow suppression commonly leading to leukopenia. These complications can be monitored based on complete blood count tests, while regular monitoring of weight, blood pressure, fasting lipid, and glucose are significant to detect any complication of cardiovascular disease.
Question number 11. DW asks about what plasmapheresis does and why might it help her feel better. Describe how you would respond. So plasmapheresis is also known as therapeutic plasma exchange, which means that the plasma is exchanged for therapeutic purpose. It is actually a process in which by using a machine, the liquid part of the blood, which we call plasma, is separated from the whole blood. Then the plasma is either replaced with another solution such as saline or albumin, or the plasma is treated and then returned back to the circulation in the body. The main purpose of plasmapheresis is to eliminate any pathogenic autoantibodies and circulating immune complexes in plasma, which is normally present in SLE patients. In people with autoimmune condition, these autoantibodies usually will attack healthy cells and cause disease and organ damages like lupus nephritis. So, removing these antibodies from the plasma will help in preventing it from attacking healthy cells and cause damage. Usually, after plasmapheresis treatment, patient will feel much better. This is because this treatment reduces symptoms of lupus disease.
After receive patient vital signs, she is suspected with side effect of plasmapheresis. The side effect is rare but it can happen. Since she had a history of nephritis, her blood pressure is increased and angiotensin-converting enzyme ACE inhibitor will be given. However, this ACE inhibitor will increase the bradykinin level. Accumulation of bradykinin will lower blood pressure during plasmapheresis. Hypotension can also happen due to rapid shift during the treatment. The body temperature also will affect it. To counter this effect, normal saline boluses will be given and keep patient warm.
The next question is asking about care activities for DW that will be included over the next 2 to 3 hours. So the first one will be reducing the dizziness and headache. The second one is stabilize both the blood pressure and temperature that is dropping due to plasmapheresis side effects. Lastly, assess neurological signs and notify the doctors if any of them appears.
Question 14. What outcome criteria would support that DW condition is stabilizing? Patient condition begin to stabilize where their symptoms are reduced after responded well to treatment, but the disease cannot be cured as currently no treatment that can cure SLE completely. Once there is a stable response, tapering of treatment and careful monitoring should be initiated as shown in the slide. At this time, patients with stable disease activity should be reviewed every 6 to 12 months.
15. Identify at least 5 topics that she must be taught before she is discharged that might help her lead as normal life as possible. Number 1. Self-care with SLE and kidney complication. Number 2. Take medication as prescribed. Number 3. Adapt with the new lifestyle. Next, implement precaution and good hygiene. And last, go direct to physician if needed.
16. How should you respond to DW's husband concerns? As lupus is a progressive disease, and of course, cutting back or stop working must be necessary for her health. However, we should understand this is a difficult decision for DW if she is passionate about her career or is about financial necessity. It can be a tough decision to make. A number of factors might influence these decisions. One is the type of work she does and the physical demands associated with her job. She can also discuss with her employer if reasonable accommodation can be made to help her stay on this job, like if she can telecommute, work at home part-time, or take on less stressful responsibilities. DW's husband should have meeting with DW and her employer to discuss any services or options that are available to them.
Here we conclude with reference. That's all from us. Thank